Here's something that might surprise you. A medical practice can have a completely full schedule, patients in every room, providers booked out for weeks, and still be in serious financial trouble. I know because I spent more than 20 years on the inside of healthcare operations, and I watched busy, well-respected clinics quietly struggle in ways that patients never saw, ways that most people inside healthcare didn't fully see either. Rising costs, insurance denials, staffing crisis, administrative burdens that consume hours every single day. These things don't show up in the waiting room, but they absolutely show up in the financial health of an organization, and eventually in the care you receive as a patient. That's what this channel is about, pulling back the curtain on the business side of healthcare, the side nobody talks about. Welcome to Behind the Business of Healthcare. My name is Heather Skousen. I hold an MBA with a focus in healthcare administration, and for over 20 years, I led the operations of a specialized outpatient vascular and interventional practice, managing everything from staffing and finances to regulatory compliance and workflow systems. In that time, I saw healthcare from an angle most people never get to see, not from the exam room, from the back office. From the budget meetings and the insurance denials and the staffing shortages and the decisions that kept a practice running, or didn't. On this channel, we're going to talk about all of it. The systems, the financial pressures, the leadership challenges, the operational breakdowns, and why they matter so much more than most people realize. Because here's the thing, healthcare isn't just medicine, it's operations. And when operations struggle, patient care eventually struggles too. So let's start with that myth, the idea that a busy clinic is a healthy clinic. It's an easy assumption to make. If the schedule is full and patients are coming through the door, the money must be coming in, right? Not quite. Revenue in healthcare isn't simply a function of how many patients you see. It's the result of a complicated chain of events. Billing, coding, prior authorization, claims submission, payment processing, and any breakdown in that chain can mean the work gets done, but the payment never arrives. At the same time, expenses don't pause while you're chasing reimbursement. Payroll runs, rent is due, supplies get ordered, equipment gets maintained. The cost of running a practice are constant, regardless of what insurance decides to pay, or when. So a practice can be incredibly busy and still be financially fragile. Volume alone doesn't protect you. One of the most significant pressures healthcare organizations are facing right now is staffing. And I don't mean finding bodies to fill positions. I mean finding experienced, trained, reliable people in an environment where burnout is at historic levels. Think about what it actually costs when a healthcare employee leaves. There's the recruitment costs, the time spent interviewing, the onboarding process, the weeks, many times months, where a new hire is still learning the workflow, the physician's preferences, the systems, the pace. During that ramp-up period, productivity dips. Other staff absorb the gap. Mistakes are more likely. Patient experience suffers. And if turnover keeps happening, that cycle becomes relentless and incredibly expensive. Healthcare organizations are also facing serious wage pressures right now. The competition for skilled clinical staff has intensified, and practices that can't match compensation are losing people to hospitals, to other specialties, and sometimes out of the healthcare industry entirely. Staffing isn't just an HR problem. It's a financial problem, an operational problem, and ultimately, a patient care problem. Now let's talk about something that consumes an almost unbelievable amount of time and money in healthcare: the administrative burden tied to insurance. Prior authorizations alone are a significant drain. Before many procedures or treatments can happen, a practice has to submit documentation to the insurance company, wait for a response, potentially submit additional information, potentially appeal a denial, and sometimes wait days or longer before getting a yes. Meanwhile, the patient's waiting, the physician's schedule is affected, and the staff hours spent navigating that process, they're real costs that don't show up anywhere on a remittance advice. And even after care is delivered, the work isn't done. Claims can still deny. Credentialing issues can delay payment. Payers can request additional documentation. Each one of those touch points requires staff, follow-up, and expertise to resolve. The administrative infrastructure required to get paid for care that has already been provided is enormous, and it's one of the things that makes running a specialty practice so operationally demanding. Here's something most people outside healthcare don't know, and it's one of the most important dynamics affecting practices right now. In most industries, when your costs go up, you raise your prices. It's simple economics. Healthcare doesn't work that way. When a clinic contracts with an insurance company, that contract sets a maximum allowable reimbursement for each service. Anything above that amount gets written off, contractually. The practice doesn't get to charge more just because their costs increase. So here's the problem. Medical supply costs have been climbing steadily for years. Staffing costs are up. Overhead is up. But reimbursement rates from many payers have stayed flat or, in some cases, actually decreased. That means practices are getting squeezed from both sides. The cost to deliver care goes up. The payment for that care doesn't keep pace. And the gap between those two things is what threatens the financial viability of independent and specialty practices across the country. It's not a dramatic single event. It's a slow, grinding pressure that builds over time. Something I came to understand deeply over 20 years is that small operational problems become very large financial problems, given enough time. A scheduling inefficiency that wastes 15 minutes of provider time every day across a full year, that's a lot of lost revenue. A front office error that causes a claim to deny and requires resubmission, that's a delay in cash flow and additional staff time. A training gap that creates inconsistency across your team, that's errors, rework, and patient experience issues, compounding quietly. None of these things look catastrophic on their own, but in healthcare operations, everything is interconnected. A breakdown in scheduling affects providers. A provider delay affects patient throughput. A patient throughput problem affects billing. A billing problem affects cash flow. And cash flow affects everything else. The practices that perform best financially aren't always the largest or best funded. They're often the ones with the tightest, most consistent operational systems, the ones that caught the small problems before they became big ones. I want to take a step back for a moment because everything I've described, the finances, the staffing pressures, the administrative burden, the operational inefficiencies, these aren't abstract problems. They play out through people. I think back about the medical assistant who started her career passionate about patient care and left 5 years later exhausted and undervalued. I think about the physician who got into medicine to help people and now spends hours a week reviewing denials and taking peer-to-peer phone calls from insurance companies trying to get a procedure approved. I think about the patient who waited 6 weeks for a procedure not because the doctor wasn't available, but because getting insurance approval took that long. Healthcare leadership means making decisions that affect all of those people simultaneously, balancing patient access, employee well-being, physician satisfaction, financial sustainability, and regulatory compliance, often with limited resources and no perfect answer. That tension is real, and I think it deserves to be talked about honestly. The operational side of healthcare is invisible to most people, but it shapes everything. Who can access care? How long they wait? Whether a practice can keep its doors open? Whether the staff who show up every day feel supported or burned out? That's why I wanted to create this channel. Not to complain about the system, but to actually explain it. Honestly, specifically from the inside. Because I believe that when people understand how healthcare works operationally, they ask better questions, make better decisions, and push for better outcomes. Whether you're a patient, a clinician, a practice manager just starting out, or someone who leads a healthcare organization, this is for you. If this is the kind of conversation you've been looking for, I'd love to have you subscribe and follow along. Coming up in future episodes, we'll dig into why clinics constantly run behind schedule, how staffing shortages actually affect the care you receive, what nobody tells you about healthcare billing, and how AI may fundamentally change the way healthcare organizations operate in the next few years. Thank you for watching. I'll see you in the next one.